everyone. Welcome back to this episode of This Healthy Life podcast. I'm super excited for my guest today. I have Dr. Taylor Krick here with me, and he is an expert in autoimmune conditions and what might be one of the root causes that is triggering those autoimmune conditions. So very excited for you to share your wealth of knowledge with the audience today. Welcome. And I'd love for you to start with a brief intro about yourself.
Sure. Yeah. Thanks, Erica. So my name is Dr. Taylor Krick. I'm a chiropractor. So I've heard every comment possible about my last name and chiropractic. Yeah. But for years I did adjustments. I did chiropractic, but I also taught people about nutrition and exercise, just healthy living. But I would see people with mysterious issues, people that had mysterious fatigue or, fill in the blank, even as part of your story, Erica, mold, Lyme, and just people that had gastro symptoms, neuro symptoms, endocrine symptoms, and everybody sends them back to the psychiatrist, to say it's all in your head. So I got more and more intrigued by that. And long story short, just started doing more functional medicine work, more labs, more gut health, more detox, and then discovered autoimmunity in myself. So I started diving more into the autoimmune world. But that's kind of what I focus on now, is helping people with chronic and complex health conditions, which sometimes includes autoimmunity and sometimes might not, but encompasses kind of this world in which you and I both live and help educate people about the drivers and the solutions. So that's kind of my background.
Yeah, absolutely. Yeah, thanks for sharing. So, it seems like everyone I talk to nowadays has an autoimmune condition of some sort, right? And it's like, it's so easy to just kind of go to your doctor's office and have a set of symptoms, and they're like, oh, you have this autoimmune disease and you're probably going to get more of them. So what is creating this like crescendo of all these people starting to get autoimmune diseases? Like there has to be some sort of underlying root cause that you're starting to see a lot in your practice that, like you mentioned, all these people were having like neuro symptoms and fatigue, and like, what are you seeing kind of deep down once you start diving into their medical history that these people are dealing with?
Sure. Well, a couple things, for one, I think there's multiple parts to that, problem that you just listed. One is that the diagnosis is more easy to find, or you do the right labs and you say, oh, you have Hashimoto's, and so a lot of times I think in the conventional world, the doctors are just looking for some explanation to give you, and then as soon as they find some explanation, it's like, oh, you have autoimmunity, see ya, and it's like my job is done. But so there is a growing, we're finding it more. But there's also the growing incidence of it too. And I think that to answer your question, there's not really one needle in the haystack. But I would say that in our world today, we're just, if I could say one explanation, I'd say toxins. Toxins. We're exposed to so many more toxins than our parents or our grandparents were. And that might mean toxins in the food supply. That might mean toxins in the water or in the air supply, or fill in the blank. But that'd be my short answer. But there's also toxins will disrupt immunity, and then we can get a more infectious burden. And so the toxins might still be at a root cause, but there's all these things I would say that are changing in our environment that are known immune triggers, like toxins and infections and viral activations and parasites, and then other, mechanisms, Erica, like mast cells are more famous and more involved than they used to be. But all these things just drive immune dysfunction. So all that's leading to an increased awareness and an increase in diagnoses of these autoimmune conditions, because they are increasing in the incidence as well. But there's not one real thing. It's all these things. And I'll show you too, I'll do it with my hands, that I learned this from a mentor of mine, but there's 5 main drivers that are causing this. And so the 5 are foods and gut health, toxins, stress, hormone fluctuations. So that could be perimenopause, pregnancy, puberty, etc., and hidden infections. So mold, Lyme, co-infection. And all 5 of those, it's not usually one or the other. It's usually some combo of them, but they'll drive this immune dysfunction.
Yep. And once you have one of those things going on, it's very easy for the other things to kind of take hold, like you kind of mentioned too, right? Like you're exposed to all these toxins, and then all of a sudden you get exposed to Lyme or parasites, and that infection really has more kind of room to grow since your body's already so compromised.
Exactly. Your immune system's suppressed. It can't eradicate the virus or the pathogen or whatever it is. And then that infection itself is a stressor. So a lot of these too are vicious cycles. So you get stuck into one of them and then they create other vicious cycles. But the point of a vicious cycle is that it keeps going and going and going until something actually gets in and stops that. But they're all interconnected, which is quite interesting and keeps my job, really fascinating because
Hmm.
and no two people are the same.
Yeah.
Even if they have the same symptoms or even if they have the same diagnoses, no two puzzles are the exact same, but we all kind of fit into this framework
Hmm.
in the same way.
Yeah, absolutely. And then, so what are some of the most common autoimmune conditions that you are seeing? So you mentioned Hashimoto's. I have that as well. My husband has it. Like every other person I talk to has something going on with their
Me,
thyroid. So,
yeah, me
that,
too. And that one's number one. Sorry to jump in, but that one's number
yeah,
one. And I think that partially again because it's just number one out there. It's easy to
yeah,
test for. It's
yeah.
because a lab test, a pretty simple blood test says yes you have it or no you don't have it. Whereas some of the others you need more, like MS, you need lesions on your MRI. So it takes a lot longer to get the MS diagnoses. But a lot of people have neuro symptoms. A lot of people have dizziness. A lot of people might feel off, and they'll go to their neurologist and say, "Good news, you don't have MS." But Hashi's is the most common. But back to your question, and again, sorry, I think I jumped the question a little bit. But Hashi's, and then everything else. Meaning, I see a ton of MS. I see a ton of rheumatoid arthritis. I see a ton of Crohn's and IBD. But it's again like I might have, I don't know, out of all 100 autoimmune people, I might have 5 IBDs and 5 joint and 5 mixed connective. It's not like a ton of any one camp, but even if you just Googled what are the most common autoimmune conditions, that's basically what I see in my office because lupus just isn't as common. Sjogren's just isn't as common as rheumatoid arthritis or MS is. And those tend to be the people that find me through my podcast or through my channels too, because they're
Hmm.
looking for autoimmune answers.
Yeah, absolutely. And then are you finding that certain autoimmune conditions are tied more to certain root causes, like say, MS or rheumatoid arthritis are more tied to like Lyme and co-infections versus, maybe something going on with like Hashimoto's is more like toxin related, or are you able to kind of put them into buckets and be like, hey, if you're dealing with this, most likely this is your root, or is it kind of just all over the place?
I mean, I think a little bit of both, because I think that to me, it's impossible to not see trends. If you see 10 MS people and 8 of them have mold, you start to think like, man, I wonder if the 11th one is going to have mold. And I do think of neuro things. I think of neurotoxins. So with MS and with lupus or some of those that might be more systemic, I think of toxins. Whereas with Hashimoto's, I might think more there's infection or there might be more, gluten being associated with Hashimoto's. But I would also say the distinction to me, Erica, is like what cause versus like what do we correlate them with? Because I see like a ton of yeast in Hashimoto's people, but I don't know that yeast caused it. I just think that if 50 people come in my door with Hashimoto's and we run stool tests on all of them, we're just gonna find yeast on a high percentage of them. But I don't know that the yeast necessarily caused their Hashimoto's. So there might be some coincidental findings or some correlative findings that might not be causative. Um, but I do think of toxins again as like my
Yeah, just
generic
kind of
answer as the biggest
something that shouldn't
driver.
be in there,
Yeah, yeah.
right?
And I would say too, another one that is, because infections I think make sense to people. I think the gluten even makes sense to people. But I think the number one thing that I see is mold and stress. I've got just a variety of autoimmune people with Crohn's or MS or whatever the case is. And it's like it all started when I was going through a divorce or I was going through a lawsuit or I had a loss of a loved one or I had one thing happen and then another thing happened and another thing happened. Um, so I do think that stress is often the most obvious trigger, but I think sometimes it's not, like I said, there's no needle in the haystack. Sometimes there's one straw that breaks the camel's back, but it's not necessarily the needle in the haystack, but
Right.
that is really
What set it
common.
all off? Yeah.
Yeah.
No, that's perfect because you actually segued into my next questions because I was going to say, stress is definitely something that, it's so easy to just be like, oh, I'm stressed, or everyone has some level of stress, but what are we actually doing about it? What are we doing to kind of mitigate that? And I don't think people do have any concept of like how much that is wearing down your immune system and how that much that affects your sleep, which is when your body's kind of restoring and rebuilding itself. And if you're going to bed anxious and can't sleep because you're stressed, like you're never getting your body out of that kind of fight or flight sense. So what can people do to manage stress? I think that's like $1 million question, right? Like
Yeah.
everyone's different, like everyone has something different, but what are some kind of key strategies that people, especially if they're dealing with an autoimmune condition, can
Yeah.
implement to manage that?
Well, I'll tell you, first off, from a more obvious standpoint to a less obvious standpoint, to your point, a lot of people know it's stress, but it's like, well, what are you going to do? Take an adrenal support? And that's a good thing. But there's also mechanisms of stress with meaning like adrenals and cortisol being too high or being too low, or chronic stress versus acute stress and things like that. And that can be tested. So sometimes we know that that's a factor, but taking an adrenal support is often the solution for that. I also think that GABA supports can be really helpful just with a lot of like neuro things. The most helpful, and I'm skimming the answer a little bit because there's a lot of possibilities, like you said, but I think to me, I'm a big fan of just understanding the mechanisms of stress, of like sympathetic fight or flight versus parasympathetic, adrenaline versus cortisol, because cortisol mostly gets demonized in our world. But I think, in my opinion, cortisol is like a really important thing. It's anti-inflammatory. It helps balance adrenaline. GABA versus adrenaline. So understanding those things helps us know a little bit more about the potential solutions. But my short answer to your question, vagus nerve stimulation is one of my favorite things. That's something that we, started doing years ago. Honestly, I learned about it from some of my mentors, and then I made a YouTube video about it just to, at the time, Erica, just to show my patients how to do it, show my clients. But it went, I don't know if viral is the right word, but it's like gotten pretty popular. So now we've got tons and tons of people doing this that just love it. So I'm also a fan. I'm a fan of supplements. I own a supplement store. We've got, 500 or 600 different supplements on our shelves, but I'm also a fan of things that don't run out after the bottle's empty. So vagus nerve stimulation can hook on the ear and stimulate that vagus nerve. And it's been shown to help, meaning in the research, it's been
Mm-hmm.
shown to help with almost every autoimmune condition.
Hmm.
So whether it be with,
Yeah, I'd love to
yeah,
dive in a little bit more to that. So I've heard
ask,
a little bit
feel
about
free.
it and I've seen some tools, but I'm kind of a little new to the whole, vagus nerve treatment stimulation to help with stress. So I'd love for you to kind of break that down, how that works and how people can access that.
Sure, yeah. So the vagus nerve, the external ear, is the only place on the outside of the body that the vagus nerve travels. Otherwise, it goes to the heart, to the lungs. And so doing things like deep breathing is stimulates the vagus nerve. Doing things like meditation or yoga, which we all know are calming and we all know are good for stress and things
Hmm.
like that.
But not
But they
everyone does
all,
it, right?
not everyone does it exactly. And I think that's the point of this little device, is it's easy. Meditation's a great idea and it's great, but not everybody has the time or the discipline or the energy to do that. Whereas hooking a TENS device on your ear is easy. I do think that when I first started talking about it, there weren't a ton of devices out there. Now there's a ton of devices, and some are like $300, $600. I saw somebody one time, they got one for $900, but a TENS device is inexpensive and really easy. And so it clips on the outside of the ear and just provides some sensory stimulation. And people feel calm. They feel, and I've got, just hundreds of people that have said things like, I feel so zen when I'm doing this. I feel so calm when I'm doing this. I think my wife, when she first did it, she said, what is this supposed to do? I feel like I'm melting into the couch, because she just felt relaxed. But
Yeah.
it's low risk. And so that's what I use, is probably the cheapest, easiest tool. And there are studies out there, uh, supporting the use of just a TENS device. But I think it's the easiest thing that you can do, but it stimulates the vagus nerve. But there are more devices out there now that are wrist bound, or some that go around your head or neck, or
How do
other
those work if
ways.
the ear is the only exposed area?
I have no idea. I have absolutely no idea, because
Okay.
I don't use them, but I know that some of my people have gotten some that work through other
Other
through other,
mechanisms.
areas. Yep, exactly.
And then, so what sort of time commitment? So the people that are, already struggling to manage their stress, like
Yeah,
how often do you do this? How long is a session with a TENS device to do?
15, 15 to 30 minutes.
Okay.
And you can do it like I could easily be doing it right now while we're on this call.
Okay. So it's not
And
something that you have to kind of like just go into like a meditative state or something. You
exactly
can just do it actively while you're
that.
working or watching TV or something.
Exactly. That is the
Okay.
best part. You can do it while you're doing dishes, or I have some people, because some people, struggle with like, well, I'm not getting it in all the time. I'm like, okay, well, like I had somebody recently, I was like, how far away do you work? They said, yeah, it's about 20 minutes. I said, put it in your car. Just do it on the way to and from work. But by doing this improves the vagal tone. And the vagal tone is kind of like improving your muscle tone. If you're not using it, then it will lose tone. And so the goal isn't to have a Xanax like effect and have you be immediately calm, but as you do this repeatedly, let's say every day for 30 days, you're going to improve that tone, and you're going to feel like things might be bouncing off you easier. You might feel more resilient. Or if you have some symptom like joint inflammation or tinnitus or something like that, then it might directly impact your symptoms. But that's the goal, is improving the parasympathetic tone. But 15 to 30 minutes, minimum of one time a day. If somebody's in a flare, really bad flare, I might say, hey, do it 2 to 3 times a day. But if the fire is not as bright, then you don't need to pour as much water on that fire. And I'll show people, Erica, the studies, because if somebody comes in with Crohn's disease, I'm going to show them a study about how vagus nerve stimulation helps with Crohn's disease. And part of that is to just convince them that it's worth doing, but also to show them that the evidence exists and that, hey, this might help. So let's try it for the next 30 days and let's see how you're doing. But that wouldn't be the only thing we were trying. We might also be trying some dietary strategies or some supplement protocols or some lab-based targets or things like that. So we're never putting all of our eggs into that basket, I wouldn't say, but it's an awesome thing to add. And it is the $1 million question of like, well, what can I do for stress? But that's a great one.
Yeah, it seems like an easy one that people can integrate, don't have to kind of carve out this whole time commitment to meditating. And that can even be hard, right? Like, especially like even me, like I've dabbled in meditation and I've had moments where I stick with it, other moments where I'm just like, I just can't right now. Like I don't have time, which is like the one thing I probably need to like de-stress me, but finding that 30 minutes to an hour a day to do it and kind of stick with it. And I'm more like an active mind. So something like that is working on your nervous system, but you're still active during, seems a little bit more appealing to me. And I'm sure a lot of people, also people with autoimmune disease tend to be a little bit more type A too, right? So like we're already a little bit more high strung and active. So yeah.
Yeah. And it's an easy thing to use. Now I've got one example of, I had this girl and she loved it, but she was a CrossFit instructor. And one of her students came to me and she said, oh, Carrie wears hers while she's teaching our boot camp. And I said, well, you don't need to be pressing the brake pedal at the same time you're pressing the gas pedal. So that might not be the best time, but it's easy. You can do it while you're watching TV. You can do it while you're doing dishes. And it does, you feel it a lot of times. You feel calm when you're doing it. But the goal is to improve that parasympathetic tone. Yeah.
So if you're just starting to use it, like how long before you start to get an improvement in that parasympathetic tone and start to notice kind of more lasting results from regular use of it?
Yeah, well, the tough thing is it's a really hard thing to measure, so we can't say like, did it succeed? Did it fail? Did it work? Did it not? But usually people feel it, so it kind of depends on what our goal is. If somebody's got rheumatoid arthritis and they're in pain, I'm going to say, hey, do it every day for 30 days. And in 30 days, I'm going to say, hey, where's your pain at? It wasn't, last time you were here, it was an 8. Is it a 7? Is it a 6? Hopefully it's not a 9. But if it's coming down, then because that becomes the $1 million question, is like, well, was it this that did the work or what helped? And at first we say, who cares? If you feel better, then who cares? It was probably a combo. But then we figure out like, well, how often do we need this or when do we use it? And a lot of times that's actually a good thing to illustrate how my practice works. Is the beginning, we might be doing 5 things. And if somebody improves, then we say, well, who cares as long as you're better? But then we try to figure out which one was it.
Yeah,
so then
it's so hard to tell, right? Especially when you're doing so many things at once too.
It is. But once somebody gets happy, then we start pulling back on things. And then we see when they flare, well, what helps you get out of a flare? because a lot of times if somebody flares, we can get out of that in a day or two or a week or so. And it doesn't take us like, hey, we need to do this for a few months. We need a detox. We need to work on your gut for a few months. It's like, hey, I flared last Friday. Okay, let's see if we can't get out of it by Monday. And sometimes we can't, but we start to see, okay, what's working and in which situations. Because a lot of times somebody comes in and it's not easy, of course, but we can get them feeling okay. We can get them feeling good. We can get them happy with where they're at. But then when I always say, I mean it in the nicest way, but I love it when people flare because then we figure out, well, what could put that fire out?
Mm-hmm. And
But
also
yeah,
try to figure out what caused it, right?
exactly,
Yeah.
exactly. Was it like, did you eat gluten? Did you go out and drink alcohol? Did you get sick? Did you go stay in a moldy
Mm-hmm.
hotel? Did you get bit by a
Mm-hmm.
tick? What triggered this and what can we pour on that fire to put that fire out?
Mm-hmm.
Exactly,
Yeah,
exactly, exactly.
absolutely. Awesome. So you mentioned gluten, so I want to talk a little bit about diet as well.
Okay.
So what are some kind of non-negotiables that if you're dealing with an autoimmune disease or, some of these like mystery chronic illnesses, what are some things that you should definitely be conscious about cutting out of your diet and then things that you should also try to include in your diet to help your health?
Yeah, good question. First off, it's a hard answer because to me, and a lot of people don't say this, I don't have any non-negotiables. I think it's all very, very customized, and I don't really fit into any one camp, like the carnivore camp or the keto camp or the vegetarian camp. I've got kind of all the above. I would say with autoimmunity, it's gluten, grains, dairy, eggs, top four, and everything else is kind of distant behind that. But it kind of depends also too on like symptoms, goals, even budget, because I don't test food sensitivities on everybody. But if somebody comes to me with an autoimmune condition, and especially if they're flared, I might say, let's test your foods. And then those things might move higher up the priority list. But let me answer your question in a roundabout way a little bit of like, because I have a lot of people that say things like, okay, let's say somebody comes to me and they're inflamed. This is a true story. I'll tell you this one. This is a true story. And I say, hey, you need to cut out gluten. And they do, let's say for 30 days or 60 days. And they're like, hey, I feel a lot better. Say, okay, great. And then we start pulling back on how aggressive we are. And then they might say, hey, I tried a little bit of gluten the other day and I was fine. So I have this girl and she said, I can eat a little bit of gluten and I feel fine now. So, okay, good. She said, but I went to Disney World with my kids. I ate it 3 meals in a day, and I will never do that again. So I think that sometimes the right answer at the beginning is go 100%. But if somebody starts feeling good, then I'm like, hey, test the waters. And a lot of people will say, boy, I can't eat eggs. Boy, I can't eat ice cream. And they touch that hot stove and they get burned and they know they can't touch it again. But a lot of times they touch it and they don't get burned. And that's a great sign. It's not to say that you should go eat gluten every meal, but it's a great sign. Or I had another person recently who said, I love fried chicken. I haven't had it in years because of how bad it makes me feel. But she said she has POTS. She had mold, bunch of crazy stuff. But she was like, the other day I'm feeling pretty good, and I went out and ate some fried chicken, and I was fine. I was like,
Yeah.
okay, good. That's a
Plus your
good
body
sign.
gets more resilient, right?
Exactly.
Yeah.
Now, I'm not saying go eat fried chicken every week or every day, and she's not going to do that anyway.
Yeah.
But at some point, that's a good sign that we've established some healing. And the word that you just used is exactly it, like the resilience. Like the same thing to stressors. If somebody's feeling overwhelmed by every little stressor, then we want to improve your resilience to stress. And you can't measure that on an adrenal panel. Or if we want to improve your resilience to foods, then that's our goal. But it might not be all or nothing. Or another, just kind of cherry picking on some things, because you also mentioned like, well, what should people eat? Well, a lot of people that I see, they don't tolerate a lot of starches and fibers because they might get bloated. It's one of the most common things that we see. It's like people are trying to eat, salad bar and broccoli, cauliflower, lettuce, things like that. And they're like, oh, I feel bloated. So their body's not tolerating a lot of those plant foods right now, but those are great foods long term. So right now we might have to avoid those like FODMAP foods or histamine foods or lectin foods or things like that. But that the goal in the long term is that shouldn't have to be a forever thing. We always say people hate the F word, which is forever. So we try not to use it, but there are certain things that I think are best to steer away from, like gluten. Gluten's a good one to just steer away from. But I think that some people can be 90-10 or 80-20 sometimes or whatever it is. But if you can be 100-0, that's always good. But I think bright colors, strong flavors, those are foods, they have bright colors and strong flavors for a reason, and those are things that tend to support, detox pathways in our body and antioxidant pathways and things like that. But otherwise, to me, the diet's more about like, hey, whatever you're pouring on your fire, if it makes the fire bigger, then that was gasoline. We don't want to do that. And if it makes the fire smaller, then that was water, and that's what we want to do, is put that fire out.
Absolutely.
Yeah.
So you mentioned histamine, and I want to segue a little bit because that is such a buzzword, especially in the last couple of years.
Yes.
5 years ago, no one knew what that meant. No one knew what mast cell activation is. And now it's like another one of those things that every other person I talk to has mast cell activation or is on a low histamine diet or just, something along the line. So let's break down, what is mast cell activation? What is histamine? What is going on? And why are so many people dealing with this now?
Yeah. So, and one thing I'll say too, because it just raises, I would say partially the controversy, or also like the he said, she said, most people straight up don't have mast cell activation. Mast cell activation is a very tight diagnostic criteria that most people don't qualify for. But they might have mast cell mediated issues, and that's a lot of people. And there are a lot of things that have changed, especially in the last 5 years, one of them being COVID, which is a major one, of course. Another one that doesn't get talked about as much being the rollout of 5G and the increase of EMF, which I think was already happening before COVID, but it did ramp up around that same time. But there is a growing, again, awareness, but there's also, it's not just the fact that it's trendy and then it's on Instagram, TikTok, podcast. It really is happening. We're seeing more and more people with more and more symptoms. But mast cells are just a cell in the body. Everybody has them. Everybody has millions of them, and they're just a cell in the body. But they kind of work as our alarm system. And so I always say, if you have an alarm on your house, you want it to go off if somebody comes in and kicks in your front door. That's what it's supposed to do. But what happens is when the alarm's too sensitive, every time a leaf blows by your front door, the sirens are sounding. And so the mast cells are kind of like the alarm system on our bodies. And so viruses, toxins, stress, all those things that the body sees as a danger, all trigger these things. So viral activations or viral things, Lyme and different infections. And when I say viruses, I just mean infections of all kinds, parasites, Lyme, tick-borne, bacterial. But those all can trigger mast cells to be activated. So then mast cell activation is a disease that some people have, but everybody can get mast cells that get activated. The best example is people that have had allergies, So you walk into PetSmart, and if you have a pet allergy, boom, your mast cells are going to get activated, and they release histamine. Now, they also release like 300 other things. So histamine is just the most famous, but they release a bunch of other things like just driving inflammation. So mast cells line the joints. In patients with rheumatoid arthritis, they have 5 to 25 times more mast cells in their joints compared to normal control patients. In patients with MS, they have more mast cells in their brain, and that's a well-known thing. In people with thyroid, their thyroid mast cells can be activated. In general, the mast cells are the most dense in areas that interface with the outside world. The skin, the sinuses. So the skin is like hives or poison ivy or something like that. The sinuses is like your traditional allergies and flushing and snot and sinus and histamine production up there and antihistamines. The gut is like heartburn, stomach burning, bloating, and the mast cells line the digestive tract and digestive system. So when they get more activated, you get more inflamed. So you might feel more reflux or diarrhea, or you might just feel bloated, like somebody punched you in the gut or something like that, because you're just more inflamed. Or mast cells are implicated in endometriosis. So, and it's a lot of times it's inflammation in hollow spaces, sinus, lungs, gut, brain, uterus, and
Mm-hmm.
also the joints. The joints aren't really hollow, but it's
Mm-hmm.
still, that's
Has
mast cells. But they
space
can,
to be inflamed in there.
exactly, but
Yeah.
they can be activated by all these bad things. So the things we already listed, stress, pathogens, gut inflammation, foods, all those can drive this more mast cell activation, which can lead to more histamine, which doesn't always mean you have mast cell activation syndrome, the disease name, but you can still have more histamine mediated symptoms. And it can be hives and skin things, or it can be anxiety, headaches, insomnia, brain fog, really famous, heart palpitations, really famous, POTS types, dysautonomia symptoms, anxiety and panic attacks, or any of the other things I threw out there, but they're really involved in all the things we talked about, like Lyme parasites, toxins, infections, COVID, et cetera. So I think that's one of the reasons why they've grown in popularity and in prevalence, especially in the last
Mm-hmm.
5 years.
Mm-hmm. Yeah, that makes sense. Yeah, I mean, especially with like COVID too, right? Like that's like a whole new infection. And then how is histamine related to like say like cytokines? Because that's like such a prominent word now too, right? Like the cytokine storm that can have things
Yeah,
with like mold and long COVID and things like that. Do you see a relationship between that and histamine, or are they just kind
absolutely.
of two different mechanisms that the
They're
body's
they're
using?
super related because mast cells are an immune cell, so they release cytokines. They release TNF alpha, which is a major inflammatory cytokine. Like a lot of people in the autoimmune world might be put on Humira or different TNF alpha blockers or different biologics, but they not. So it's not just histamine; it's also the cytokines. But then they're also triggered by cytokines. So it's one of those vicious cycles that if I, I was gonna say if I punch you in the face, that doesn't sound very nice. But if you got hit in the face by something, you're gonna get inflamed,
Mm-hmm.
and then that can trigger these mast cells. Or if you get an allergen or something, that can trigger the inflammation even without the punch in the face. So these roads go both ways. And I also too, Erica, like I do a podcast too, but I'm super, super visual. So I show people a ton of studies and graphics and pictures that can show this just pretty quickly and say, hey, this is a mast cell. This is what it can be triggered by. When it gets triggered, this is what it can release. And then this is what it can cause. But absolutely, if somebody's got more joint pain, then I'm not necessarily thinking of straight up histamine. I might still be thinking of mast cells, but I might be thinking of cytokines. If their joints are inflamed and swollen, and if they've taken a leave and it calms them down, it's like, hey, that's inflammation. But if somebody's got runny nose, I might be thinking more histamine. But those cytokines can trigger mast cells, and mast cells release cytokines. So great,
Mm.
great question.
Yeah, so it's all one
It's
big
all
happy
related,
family.
100%. Yeah. And I
Awesome.
would also say too, even with COVID and some of the, factors involved with that, glutathione can help protect against the cytokine storm that COVID can trigger. And so sometimes glutathione might get depleted, and then we get an infection and it triggers more inflammation. And then we get more mast cell activation because of that, but it might not be like what started the fire, but it might be what we're feeling. Like the heat is kind of the after effect of the fire, but the matches in the gasoline might have started the fire.
Mm-hmm. Absolutely. So if someone's dealing with, high histamine or some of these symptoms that you talked about, like having some histamine, maybe it's not mast cell, maybe it's just like a overproduction of histamine that's causing some of their symptoms. What are things that can help with histamine to kind
Yeah.
of manage that?
So mostly supplements, but also besides supplements, working on the gut. Working on the gut or detoxifying or cleaning up the air too is super important. But anything with hist in the name. Now, I just happen to have these sitting here. And I know that the podcast is audio, but for visual, these are all sitting here. Like, here's DHist. That's a famous one. Here's histamine nutrients. That's a pretty well-known supplement that's more for metabolizing histamine. But all of these supplements, Erica, here's HistoX. Most supplements that are for histamine are going to have quercetin or other flavonoids in them. Quercetin, luteolin, rutin, bromelain, things like that. But the goal is to stabilize the mast cell. But even going back to the way that you worded the question, because it was great, some people have a problem with making too much histamine. Some people have a problem with not clearing it rapidly. And some people have a problem with both. So I think that the metaphor that I always use, if somebody has these symptoms, I say your histamine bucket is full. We want to get it down. So how do we do that? Well, we stop filling it from the top. So that might be getting rid of toxins, infections, healing the gut, stabilizing the mast cells. But we also have to get rid of it from the bottom also, which might be detoxification or supporting liver pathways or supporting certain, enzyme pathways that help metabolize or clear out histamine.
Mm-hmm.
Because it's
Mm-hmm.
very, very common that somebody's bucket will be full. They know it's full,
Yeah.
but they don't know how to get it emptied, and it works from both
Just
ways. We
keeps
got to stop
refilling,
filling it.
right?
Yep, exactly. So we got to stop
Yeah.
filling it from the top. We got to empty it from the bottom. And really, I always say, too, there's 3 steps to this because you already touched on the other one. One is you got to stabilize the mast cells and stop filling it from the top. 2 is you got to empty it from the bottom. But 3 is you got to look out for the triggers. And the only reason that that's 3, it's probably the most important, but the only reason that that's 3 is because life never stops, so you're going to keep getting stressed. You're going to keep getting foods. You're going to keep getting, sick, obviously not too often, hopefully, but you might have your histamine bucket empty for all of 2025. And you're like, hey, I'm doing really good. And then all of a sudden something might come in and fill it
Just
back
one
up a
thing.
year from now. And
Yeah.
it might not be the same. It might've been COVID a year ago and it
Mm.
might be stress a year from now, but they
Mm-hmm.
both might lead to a full histamine bucket, but they might have different triggers for that.
Mm-hmm. Is
Yeah.
that something that happens pretty quickly, like filling your histamine bucket? With like toxins,
Yes.
I feel like that's kind of a slow burn, right? Like, unless you have like a major exposure to something, like it's slowly kind of filling up. With histamine, is it like you stay in one moldy hotel room for a couple nights and that histamine bucket could be completely full again? Or,
Yes.
yeah,
Perfect.
okay,
Perfect
okay.
example. But it's both. But yes. Short answer, it can fill really quickly, and that's the perfect example. That's really, really common. Is somebody's doing really great and they go and travel and it's like, oh, I'm flared. But also a lot of times people I might see, let's say I've seen somebody and a year ago they were doing great. So maybe I haven't heard from them for a while, and then they come into my office. They're like, "Hey, I'm flaring, or I'm starting to flare." I said, "Tell me what's been going on." They might say, "Well, my dog died, and then I had a lawsuit, and then I lost my job, and I've been eating like crap." So a lot of times when we look back in hindsight, we can see that the bucket was filling, but a lot of times it's one weekend, and it's like, boom, my bucket is overflowed, and then in hindsight we can see that it was filling. But it can be both, I would say. But you picked the perfect example of like the moldy hotel room
That's
could
the one that
fill it.
always gets me
It
every
is.
time.
It's the most common thing that I
Yeah,
see cause people to flare
yeah,
is traveling.
yeah,
And there's not to say that vacations aren't helpful and that it's not fun and good, and we encourage people to take breaks
yeah,
and stuff like that. But it's really, 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 really common that somebody
yeah.
goes on a trip and flares.
Yeah, what's some tips for that? I mean, for myself, like I try to be really good about making sure I bring glutathione, like NAC, take a binder whenever I'm staying at a hotel because 99% of the time it probably has mold.
Exactly.
So like in the past I maybe wasn't as good as that as kind of staying on top of it, but what are some other things that people can do to be a little bit more proactive? Like, I
I
mean,
think
obviously we want to travel, but you don't want to fill your bucket up, right?
Yeah, I think that first off, I think those two are great ones, and then I
Mm-hmm.
think that something for histamine, something with
Mm-hmm.
hist in the name, um, whether it be like here's another one, but well, wrong one, but this is hist reset or anything with hist in the name, usually as quercetin or things like that. But I think those are good things to travel with, and sometimes even before it's happened, because there's always this mystery of like, was it the crappy air on a plane? Was it the room I stayed in? Was it the restaurant I ate at? Was it the fact that I had a glass of wine at dinner when I don't normally do that or whatever? There's always this mystery, but it's like, but people clearly flared while they were traveling. But glutathione, a binder, and something for histamine are great things. Because we also, if somebody wants to travel with supplements, we want them to travel with as little as possible. But yes, I think something for histamine might be the only other thing. I think that glutathione is one of my favorites.
Yeah, I love it. I mean, it's so
Yeah,
good. I mean, I try to just be on top of it every day, but I definitely try to be really good about it when I'm traveling.
exactly, exactly, exactly. And I think whether again, because I think of, the air on a plane sketches me out.
Hmm.
There's people in the airline industry that are like, oh no, this is so clean. I'm like, I don't think
I don't
so.
think so.
Um, but yeah, it is sometimes hard to say.
Yeah.
But glutathione can just help protect you against any of those airborne exposures or
Hmm.
things like that. Yeah.
Absolutely. Awesome. So we have time for one more question. So I want to ask one more question about histamine. So, obviously you're going to be having symptoms that for you or like practitioners that are familiar with histamine are going to be able to say like, hey, this is what's going on. But, someone that's maybe not working with a functional medicine doctor, working with more like a Western doctor, is there any sort of testing that they can do to see if that's going on or anything for histamine? Or is it something that's more of a clinical diagnosis with someone that's familiar with it?
It's really hard.
Really
It's
hard,
more,
yeah.
the short answer is it's more of a clinical diagnosis.
Yeah.
You can test for things like whole blood histamine or serum or plasma histamine or urine histidine too, or histamine, but they very rarely come back positive, or sometimes they do. Or there are other things like serum tryptase for mast cell activation to be diagnosed that. But short answer is it's really hard. But if people come in and they check off, let's say, 4, 5, 6 different symptoms for histamine, first off, from my office's standpoint, a lot of times I'll show them pictures and they're like, I have that and I have that and I have that and I have that and I have that. And I'm like, okay, well, ding, 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 this is histamine. So I don't need a lot of convincing. But if somebody comes in and they just have headaches, then maybe it's not just histamine, but histamine is at least on the radar. But there is some trial and error to that. But it's really, 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 really hard to test for. But you can sometimes find also other clues. Like if somebody has yeast or mold, then they're likely going to have histamine issues. If somebody has histamine producing bacteria, like Klebsiella or Morganella, those bacteria actually produce histamine. So those are like, oh, ding, ding, ding. Those people likely have histamine issues. But it's really hard to test for or
Yeah.
confirm.
That's
Yeah.
interesting.
But
I
I
didn't
would
even
say
know that
that,
that was a thing that the like certain infections can produce it too.
yeah.
Like
So
crazy.
those two especially. But it is like a lot. I think that one of the things about histamine is a lot of the conversations that people like you and I have in the wellness world, like almost every situation has histamine involved. That doesn't mean that every situation has mast cell activation.
Yep.
And that
Yeah, it's
doesn't
good to
mean that,
differentiate that, I think, because it's like,
yeah.
you think it all goes together and it's all one package, but it's interesting that it can
Well,
be kind of different levels of it.
and it's kind of like SIBO, a lot of people are like, I
Mhm.
think I have SIBO. And then they go to their doctor and their doctor's like, ha, no, you don't. You're dumb for even asking that. And they're like, shoot, I could have sworn I was onto something. And they might still have bloating and fermentation after eating starches, but they don't maybe have SIBO if they don't blow a breath of, whatever. So it gets to be one of these like semantics things of, do I have this condition? And no matter what, first off, gaslighting the person is never helpful, but you're somewhere on the spectrum. In the far end of the spectrum of histamine is mast cell activation. And very rarely do people actually qualify for that diagnosis, but they might be on the spectrum of, hey, mast cells are involved in your condition. Somebody's got brain fog, or somebody's got fatigue, or somebody's got joint pain. So that's almost like fill in the blank for everybody that walks into my office. Mast cells are on my radar, but they might move up the radar or they might move down the radar, but they're never really off the radar. But I think it more than anything, it puts a framework in to make sense for the person sitting in front of me of like, hey, this is why we're going to kill those bugs in your gut. This is why we're going to heal leaky gut. This is why we're going to detoxify your body for the next few months. And so it just kind of, they're bought in a little bit more when they can kind of see the why. But I'm not saying that everybody that I see has mast cell diseases. I just think that mast cells are involved in most symptoms that walk into a functional wellness office.
Absolutely. Awesome. Well, Taylor, thank you so much. This has been so informative, and I hope this helps people out there if they're dealing with autoimmune diseases. And, make sure to look for that root cause because your body doesn't go haywire for no reason. So,
Yeah. Well, and I appreciate you for having me on here. And I also think that like even in the world of practitioners, I think that sometimes for like people that have been through their own health journey and then they do something like your podcast and they interview all these experts, you very quickly, I think, know more than most practitioners out there,
yeah,
like
absolutely, right?
95% of them. Yeah. So
I know.
kudos to you and keep
Thank
it up.
you.
And you're helping the community out there just, I don't know, understand their options of what they can do. So
Absolutely.
keep up the good work.
Awesome. I appreciate you. Thank you so much.
Absolutely. Thanks for having me on.
Take care.